All right. Hello, everyone, and welcome to today's panel discussion event. It's an honor to welcome you all here today. My name is Sarah Kiskadden-Bechtel, and I am the program director for the Completed Life Initiative. And today we are discussing the documentary film Prescription for Peace of Mind, an option for the terminally ill. On medical aid in dying in Connecticut. And this film was directed by Karin and Bill Schwanbeck, who we're delighted to have here today. And a little bit about the Completed Life Initiative before I introduce who's joining us today. The Completed Life Initiative was founded in 2019 and was created in an effort to promote self-determination and dignity at the end of life. The notion of what it means to live life until its completion, hence completed life, arose from our founders' desire to empower individuals to have full control over their end-of-life experience. What does it mean to live a life? How does one communicate their end-of-life wishes to loved ones to ensure that it unfolds as desired? How do we empower individuals to live as fully as possible, assured that their end-of-life wishes will be respected? How do we relieve suffering at the end of life while honoring personal dignity? So I'm also honored to welcome our co-sponsor for today's event, Ayana Woods from End of Life Choices New York. Ayana is the executive director of her organization, and End of Life Choices New York is the leading partner organization in New York working to improve end-of-life care and expand end-of-life options to ensure a peaceful death. They work hard and well to engage in a variety of educational and outreach efforts to inform the public about end-of-life options and provide support to individuals and families who are facing the end of life or wish to plan ahead and advocate for medical aid in dying in New York State, as well as other legal reforms to improve pain management, palliative care, and advanced care planning. So now I would love to introduce Karin and Bill Schwanbeck as the directors and visionaries for this incredible documentary on medical aid in dying. So welcome, Karin and Bill, and also our fellow panelists who were featured in Karin and Bill's documentary. So first, Sharon Hines. Sharon is a stage 4 cancer patient and former oncology nurse. So welcome, Sharon. It's wonderful to have you here today. Next, we have Sharon Sanford, who is a nurse in the Connecticut nursing system. And she wrote an incredible op-ed in the Greenwich Times in support of medical aid in dying when it was coming up under the Connecticut state legislature in March of this year, 2020. Next, I have Rabbi Michael Farbman, who is rabbi at Temple Emmanuel of Greater New Haven, Connecticut since 2009. And last but not least, I have Reverend Joshua Pawelek, who has served as the minister of the Unitarian Universalist Society East in Manchester, Connecticut since 2003. So welcome, everyone. It's an incredible delight and honor to have you here today. So just for your awareness, for those in the audience, today's session is being recorded. The recording will be available after the live event. You'll receive an email with the link to the recording. And we welcome your questions. I will ask a few initial questions to get us started and to promote conversation. And then we welcome your questions either in the text chat or by raising your hand. So please start sending them as soon as they come to you. The text chat, if you're not familiar, is at the bottom of your screen. It says chat at the bottom. So without further ado, thinking about this notion of the completed life, there was a quote in the film from Sharon where you said, Sharon, I want the ending that I want, excuse me. I want the ending that I want, not the one the disease can give me. And I thought this perfectly encapsulates the idea of the completed life. So I in the film, you mentioned that you've set up residence in New Jersey. You currently have been living in Connecticut for many years, but you wanted medical aid in dying as an option. And since Connecticut doesn't offer medical aid in dying, you wanted the option. So you moved your driver's license to New Jersey. So I was wondering, can you speak a little bit about your decision to set things up in New Jersey and describe what the process was like?
At the time, I actually was looking at Vermont, where medical aid in dying is an option. When New Jersey's governor signed their bill, and it was the summer, so 2 years ago, a year ago, I guess it was. So my very best friend from nursing school, who I've known for more than half my life, lives in New Jersey. And she has been a support of my wishes for medical aid in dying for as long as I've expressed them. And I asked her if I could use her address so that I could establish residency in New Jersey. And she said, absolutely. I'm so fortunate. Her home would accommodate my husband and I when the time comes. And I then looked into the regulations in New Jersey and found out that you have to do things like have along with a driver's license, show evidence of a residence. So we opened up a bank account. I then started looking for an oncologist, and the first one I came across, I had found on YouTube, who is a general oncologist, but I have stage 4 lung cancer. So I knew I wanted somebody familiar in caring for patients with lung cancer, and set up an appointment, sent all my records to him ahead of time. I'm an oncology nurse practitioner, so I've worked in the field my entire nursing career, and pretty much wrote the history and physical forum. So when I got down there to see him, he knew full well that my reason for relocating to New Jersey eventually was so I could have medical aid in dying access. So all those things have been established. I tell you, the minute it was done, I did feel such relief knowing that I had a plan in place, and that I have it as an option, something that, you know, we couldn't do here in Connecticut, and feel so much better just knowing that that's taken care of.
Absolutely. Thank you, Sharon. So Shannon, I wanted to turn to you next because you have personal experience with your father passing and experiencing his suffering. And you have spoken about this in the documentary, but also written about it in the Greenwich Times article. And I was wondering, you know, if you could elaborate on your perspective on not only access, but also what you see as the nurse's role in aiding someone in their dying process. Shannon, you're muted.
I apologize. Well, the nurse's role is very clear from the American Nursing Association. The nurse is prohibited from actually helping or assisting the patient from taking medications that would help them to end their lives. However, the nurse is responsible for being aware and being able to advise patients of their options. So as nurses, we're responsible for knowing and being aware of the legislation and the patient's rights to avail themselves of medical aid in dying. So we have to be aware of these laws and how they play out in the various states. So in Sharon's case, we would have to be able to advise her, you know, if Connecticut doesn't have that legislation of her right to go to another state that does. But, you know, in her case, if she wanted to actually take the medication, we couldn't actually administer it to her, but we could be present with her while she was taking the medication.
Thank you, Shannon. Being present is an incredibly important topic that I was curious, you know, what Reverend Joshua and Rabbi Michael think of the role of pastoral care in the dying process, and how the importance of potentially religious and spiritual viewpoints at the end of life can be comforting. So Reverend Joshua, would you mind going first, and then Rabbi Michael to speak to your viewpoint?
Yeah, I can go first. When you ask the question, it makes me think of one of the times we had raised an aid in dying bill here in Connecticut, and I was testifying, and I got the impression that some of the legislators who were asking me questions had the thought that as a pastor, what I really wanted was to be able to recommend aid in dying to everyone. And I had to make it clear that that's really not how I see my role as a pastor. Like Shannon was saying, it's about accompaniment. It's about being present, helping a person make meaning out of their death and make meaning out of their life, trying to understand what has been the purpose of their life. Can they articulate that, and can they lean into the relationship that they have, and can they repair relationships that may be broken before they die? And the last thing on my mind is, do you want aid in dying? That's just not a question that I would ask. However, I do have relationships with people in the congregation who have said to me consistently over the years, I don't want to suffer at the end of life. I don't want to spend 6 months in an ICU bed. I don't want to be on a ventilator. I don't want heroic measures. And if I'm of sound mind, I would love to be able to end my own life by my own hand. That would be a way to end my life with integrity. That would be a way to have control of my life right to the end. And so when a person who I have that history with wants to talk about it, then we talk about it. And of course, in Connecticut, there's not a lot we can do, but at least we can have the conversation. And then the only other thing I would add is that it actually is very sad when a person dies the way they didn't want to die. Their life was prolonged by medical professionals who didn't take them seriously. And that's always very sad, especially when the family knows that that's not how the person wanted to die, that they preferred a different way. And so for me, expanding the options is a critical pastoral role for me to play. And then also there's a political advocacy role.
Thank you, Reverend Joshua. Rabbi Michael, please.
So end of life and choice that comes with it, or potentially can come with it, is complicated in Judaism. It is while there's a clear understanding, or clear enough understanding, that we can remove extraordinary measures at the end of life, not to prolong suffering. The choice in ending life is not something that necessarily is an easy choice. In fact, if anything, one can argue that the easy choice is for not giving that choice. But my take on this, and I have had these conversations over a number of years, my take on this is on this and some of the other medical issues that we or medical context within which we encounter our lives, is a little different, in that I think that it's perfectly okay for us as individuals and for our religious traditions to have a take on this complex and complicated matter, which may not be welcoming. And as Josh said, we're certainly not out there talking to people and saying, "Let me tell you how you can take your own life." That is not something that in most religious traditions is present with whatever level of stricture there is. But the difference is that we in religious communities take on ourselves certain strictures, certain limitations when it comes to, within Judaism, it could be a matter of kashrut, what we do and don't eat. It could be a matter of observing Shabbat in a particular way, when we do or don't do certain things. And when we take that, I think we can and do take pride in our own religious traditions and make a lot of sense and find a lot of comfort in them. But we don't need the whole world to drop everything and to honor our religious traditions and to have our religious traditions dictate the way this plays out. So I, of course, am very much aware of the fact that individual people can find themselves in the situation where they want to have that choice. And I think the question for me is the legality of such choice, while may not necessarily work within the Jewish understanding of end of life, the fact that it would be legal still allows me and anyone else to make the stricter decisions or to go with whatever is our personal or our family members' personal choices. That is very different from saying yay or nay on the decision itself. And I hope that distinction is helpful here, because I think that's, to me at least, that's a very helpful way of thinking about the laws when it comes to laws. Making something illegal and therefore impossible is very different from dictating and telling what I, as an individual or as a religious individual or as a faith leader, can do or not do.
Absolutely. Thank you, Rabbi. So next I want to turn to Karin and Bill. Many today have talked about expanding access to medical aid in dying, to at least have the option to access it, whether or not they choose to take advantage of it. And I was curious what your thoughts are on and how you see the role of your documentary making an impact in not only the Connecticut state legislature, but also the broader US context.
So when I first started out to do this documentary, it wasn't to focus initially on medical aid in dying. It was because my father was suffering at the end and asked me to get him a gun, which was, it was overwhelming, and I was overwrought and spent sleepless nights trying to figure out how to end his suffering. And so it was because of my father's struggling at the end of life, and, like Compassionate Choices and Josh Elliott would say, we are all one bad death away from supporting medical aid in dying. So it was because of that process I began to think, I started doing research. What is it? Are there other options out there for people who are suffering at the end? Because suffering didn't seem right to me. And so it was because of that that I made this journey. And I looked at medical aid in dying, but I also wanted to look at the legal aspect of it. I wanted to see what our so-called neighboring state of Vermont was doing. I did want to look at the religious aspect of it because I know a lot of people bring that up. And I found that all religions are different and they all have a different take on this. I did find it interesting with the priest and the Lutheran pastor, even though they do say that God is the one who gives us life and God is the one who should take it away. They did say that we can decline any kind of treatment. So in God's eyes, that would be okay. For me, I'm like Sharon. I don't know if I would use it, but I would love to have a prescription at the end of my life if I'm suffering, so that I have that as a backup in case I am suffering at the end, because I have found that palliative care doesn't always work. Hospice doesn't always work. I mean, in most cases it does, but in the rare instances where hospice care is not working, where that morphine is not ending someone's pain and suffering, then I think people should have the ability to take a prescription to end their suffering.
And we also went through that suffering with your dad for more than a year. This wasn't just the last few days or weeks or months. It was more than a year we went through this with him.
Long time.
someone said that's a long time to go through that, and I can only imagine how unbearable that must have felt. Thank you both. Ayana had a question for you, Karin and Bill. So please, Ayana, go ahead.
Hi, everyone. Good afternoon. As Sarah mentioned, I'm the executive director of End of Life Choices New York, and we first learned about the film through Judy Schwartz, who was actually featured our clinical director. So thank you for including her in this beautiful film. I found it to be very powerful and persuasive, sharing different people's stories. And so for the participants on the call today, I wanted to ask Karin and Bill, how would you like us to use the film? How would you like us to share it with people we know? Legislators, families, friends, colleagues, what is your vision for how this can be shared with the world and how it can make a greater impact?
Well, do it, post it on your websites. It is on our Vimeo site. NETA, the National Educational Telecommunications Association, has recently accepted it. And so at the end of January, they will open it to all PBS stations around the country. So any PBS station that would like to air it is welcome to do so.
Interesting.
Oh, fantastic. Do you have a website or anything that kind of would let us know when that would be available? How would we have a sense of when that's going to be on? Okay.
But it will be the end. It'll be the end of January. And the way NETA works, because we've had a couple documentaries in the past that NETA has accepted, it's up to individual PBS stations to decide whether they want it or not, and when they want to air it and how they air it. Because a lot of PBS stations have different channels, right? They have different channels, so it's up to them. So for us, sometimes it's even hard to keep up with who's airing it.
Great, thank you. And I would encourage people to perhaps have watch parties and let their friends know. It's so powerful. It's also posted on the End of Life Choices website, End of Life Choices New York website.
Yeah, and it's on Vimeo. I mean, just Google Vimeo and prescription for peace of mind, and you'll find
it's right there.
It's right there.
Great, thank you. Thank you so much for your hard work on this film.
Absolutely, thank you so much. So Sarah Spieldenner has many questions, and I want to open it up to you and the audience to ask questions. You've had a chance to watch this incredibly powerful film. What are your thoughts? What are your questions now that we have everyone here in real time? So I see Kathy Kastner, you have a question, but let's go to Sarah first and then Kathy.
I have so many questions, and thank you very much. But it boils down to two. One is that there seems to be a very reasonable fear of being placed in an ICU with tubes everywhere against your will until you die. And it is my experience that if everybody, your physician, your family members, and you are all in agreement before any of this happens, that does not have to happen, even if hospice does not exist as an option for you. That you do have some autonomy about some decisions, even if medical aid in dying is not allowed in your state. So that's one thing. And the other is that there was an implication in the documentary that there is no such thing as the principle of double effect, which I know doctors can be very hesitant to enact, but it can be very useful in these situations. For those who may not know what it is, it means that when a patient has a terminal illness and is not long for this life, there is nothing that stops a physician from treating the pain that the person has adequately, even if a secondary effect is that the patient's death is hastened. And some people view this principle quite cynically. I don't, but a lot of physicians are afraid to use it, and it seems like that's an easy way to go, is to make sure that physicians know about it and use it.
So I'll ask Shannon first, and then Sharon what your thoughts are.
Yeah, thank you for that question, Sarah. It's a very good question. That's true. Through executing an advance, what we call an advance directive, a patient can, or a MOLST, that's another document that people can use. They can state their wishes ahead of time for how they'd like to be treated if they were to have a life-limiting illness or terminal condition. So they do not have to end up in an ICU against their will.
Yeah.
So anybody right now, and I love to talk about this all the time with my nursing students. I tell them, you should all have an advance directive. And they look at me like, what, I'm too young. No, nobody's too young to have an advance directive.
That's right.
It spells out your wishes for what you want to have happen to you in the event you can't speak for yourself, and to appoint a proxy to speak for you. And we can all do that today. That's one thing you should all take away from this call, that you should have an advance directive or a living will that states what should happen to you and who should make those decisions and what you would like to have done in the event you're not able to speak for yourself. And that will help to prevent, if you don't want to be in an ICU hooked up to machines. Now, some people might want that. They might want to have all the technology available to them to help them live as long as they possibly can with all the latest medical advances. And if that's what you want, you state that in your advance directive. If that's not what you want, you state that too. And that's how people can speak for themselves if they're unable to speak at the time for what they want to have. So those documents can be set up. To answer your second question about the rule of double effect, that's true. Now, if you have somebody on, palliative care at the end of life who's suffering, physician can prescribe a amount of pain medication that may carry that double effect. So they can keep them terminally sedated or sedated to a level where they're no longer engaged with the people around them because they're suffering so badly. And maybe that pain level or the level of sedation that they're at may ultimately hasten their death. But for some people, that's not how they want to go out. So for Sharon, say, and Sharon can speak to this, for Sharon, she might not want that option. She might not want to be so sedated where she can't interact with her environment. And to her, a good quality of life is not to have that rule of double effect at the end. For her, a good quality of life is for her to be interactive with her loved ones and with it all the way up to the end. So for her, the rule of double effect and being sedated to the end is not the quality of life she wants to have or go out on. For her, it's being lucid and interactive with her loved ones all the way up to the end. So that's where, the rule of double effect wouldn't be helpful for her because that's not the quality of life she wants to have. But for others, that's okay. That's the quality they want to have, and that's fine. So yeah, the rule of double effect is available to patients, and we can terminally sedate them at the end of their lives. Does that answer your question, Sarah? Okay. And Sharon, if you want to.
Yes, Sharon. Thank you, Shannon.
No
Sharon.
problem.
Oh, Sharon, you're unmuted. Sharon, I'm sorry, we can't hear you.
Better.
There we go. Thank you.
Okay. Yes, thanks for the question, Sarah. The double effect, one of the things, I worked in hospice for more than 10 years. And one of the first things I learned was somebody's always going to give that last dose of a medication. And while some patients, it may hasten death, and other patients, depending upon where they are in their disease, it can still take weeks for someone to die. And Shannon hit it right on when she was able to express what I've been saying all along is I don't want to spend weeks sedated, unable to interact with my family in a meaningful way. That's, for me, I've seen it happen many times, and it's just not what I want for myself. Dragging out the inevitable just isn't what I want.
Excuse me. Thank you, Sharon. So we'll turn to Kathy. She had her hand up before Sarah's question. So Kathy, please unmute yourself and go ahead.
Hello. Thank you. I'm from Canada. And so you may or may not know medical assistance in dying is legal here. It is not a self-administered situation. There's a doctor or an NP, nurse practitioner, that comes in and gives the lethal dose. But what I am, as an individual, I'm involved in research related to end-of-life conversations, North America-wide research on end-of-life conversations. And I'm just going to put a caveat to the POLSTs and the MOLSTs and the advanced directives and suggest that while that paperwork may be helpful to work things through, that it's equally important, if not more, to tell everyone who matters to you what your desires are, because who knows where that POLST is going to be at the end of life. And also the number of times, and no doubt some of you will be familiar with this, where in spite of the fact that you have detailed whatever you've detailed, some medical professional decides this isn't the right thing and they take it on themselves. There was a situation in Canada that I wonder, Karin, if you guys ran into this, or anyone in fact on this chat, and that is that a fellow in one of our provinces met the criteria for MAID, was accepted, and there's a process that's gone through here that is designed to do all the things that all the anti-medical aid and dying people worry about. But anyhow, he got acceptance, and his wife went to court to block him from getting medical assistance in dying. I don't know if that is an option in any of the states where you are from, but I wondered if any of you had run into family barriers to get the death that you want.
I've seen that happen.
I see everybody's rushing to answer that one, huh?
Actually, I'm game to answer that one. I've seen that happen, not with medical aid and dying cases, so much as I've seen it happen where family members are resistant to put their loved one on hospice service because they're not ready yet. They hear the word hospice and it's suddenly, oh, good God, I'm not ready to have my loved one go on hospice service. Or palliative care services, because both of those words, palliative care and hospice, are very jarring for someone to hear when they're not ready to consider the fact that my loved one may have 6 months less to live or may have a limited time on earth. So I've seen a lot of, but not to the point where somebody would go to court over it, obviously, but to the point where they're just not ready to admit that their loved one has a life-limiting prognosis. So sometimes it takes a lot to work with the family to get them ready to be able to accept that. And the reason why that becomes so important in healthcare is because we can do so much more for the patient in terms of benefits and services by getting them on palliative and supportive care than we can when they're on the regular medical benefit. So sometimes it takes a lot to work with them and get them prepared to be able to accept a palliative or hospice diagnosis. And that's usually the disconnect we have when I'm working with patients. But I've never seen somebody contest a medical aid and dying case in court, at least in the States, that I'm aware of. I don't know if Karin or Bill or anybody else on the panel have come across that.
No, not run into that at all.
That's exactly what happened in the Terry Schiavo case and most of the cases that you've heard of about people arguing about pulling plugs and turning off artificial forms of life support. Almost always it's because a family member intervened and took it to court. It can happen in any state. I mean, it just can. I'm not saying it happens every day.
Thank you, Robert. Karin, did you have any thoughts? Karin or Bill or Sharon?
Bill?
I would think that's why it's so imperative that you have your personal health representative lined up and your documents all lined up. If another family member does take you to court, you have some ammunition and you have a chance to stay true to your wishes.
I apologize. I wasn't thinking of the Terry Schiavo case for some reason. I was thinking more of assisted aid and dying. I wasn't thinking of those situations where you're right, Terry Schiavo, and there's a couple of, you're right. I do apologize. I wasn't thinking of those. But yes, you're right, that does lead clearance, give credence to the fact that everybody should have an advance directive where they clearly state out their wishes.
I was just going to add too, I see one of the problems. We have electronic charts now, and a lot of people do participate in here in Connecticut. My chart is the big one. And there's actually a place within your profile where you can put all your wishes. But nobody looks at it. I mean, I'm not sure how good the ER is about, a patient coming in, especially now in the height of COVID, about looking at that. But I know from personal experience, I've dealt with physicians who have not looked at my profile to know that. So I think it's just really important that people do have it documented. So I've been really fortunate that everyone in my family supports my wishes. And, there really has not been anyone. I have a lot of nurse friends. They totally get it. But even my family who may not agree or may not be looking for that option, but support me in whatever I want.
Another resource is the U.S. Living Will Registry. This is a service that Final Exit Network gives away free to anybody who asks for it. And I tested it last December when my wife was in a brain trauma center here in Minnesota, and it worked. I had the front desk download her advance directive. They entered it into their hospital records and it actually functioned. So something maybe you should look into.
Thank you so much, Gary. There are many resources that we'll link to at the end of the session and also in the follow-up email when you receive the recording. Many resources on advanced directives, including dementia directives, MOLST and POLST forms. End of Life Choices New York has a great section of their website where they list all of these documents. So be sure to check that out. Completed Life Initiative also has a section on advanced directives. We also run the healthcare proxy helpline, which is where you can set up an appointment with an advanced directive advocate to have a conversation about what's important to you. And as Gary mentioned, Final Exit Network is also a great resource. So we will absolutely link to those websites in the chat. And I want to offer the opportunity to respond to Reverend Josh and Rabbi Michael. Any thoughts?
Not right now, no. And I'm blanking on what you call the double.
The double effect.
I've actually never heard of that. I have had that experience of talking to a hospice nurse who admits that they upped the dose a little bit more than they were supposed to, and they're not supposed to do that, but they do that from time to time. And actually people have even testified that they do that from time to time. But my understanding is that technically that's not legal. And I may be wrong about that, but that's the way it's always framed to us, that we do it. It's a kind of don't ask, don't tell kind of thing, but we're not supposed to do it. That's what I've always heard.
All right, thank you, Reverend Josh. So I'd love to go back to questions from our audience. And for more about the principle of the double effect and its legality, I know that it is up for questioning, but we can link some resources to that in the chat as well. So Wendy DeChristina had a question about the Connecticut medical aid in dying bill. So Wendy, would you mind asking your question?
Sure. It's a great documentary. I live in Connecticut, so I'm specifically concerned about Connecticut. And I know in 2015, I submitted testimony and the bill did not pass. Is the current bill different, or is it just a hope that a better environment will encourage its passing? Or could you just speak to where it stands today?
So it was introduced in this year, but because of COVID, they dropped it. There are some additions to it. One thing that testimony that I've heard from a physician assistant who opposes the bill said something about a doctor would have to lie on the death certificate. But it says, and it's a lengthy bill, it's 16 pages. So on page 10, line 273, it does say that the doctor would need to write down the underlying cause, not that it was medical aid in dying that ended the person's life, but it was the underlying cause, whether it was cancer, ALS, or whatever. But yeah, there have been some additions, but I think that's one thing that has been clarified. I don't know if Shannon or Sharon, if you want to add.
It's my understanding that we're proposing new legislation for the upcoming legislative session. So there will be a new bill coming forward. So stay tuned. We'll be looking for people to testify and get involved, and hopefully we'll get it passed this year. You know, every year we try again. It just never seems to get out of the Public Health Committee. And we're hoping again that we'll get it through the Public Health Committee this time. So you'll hear, you know, we'll be looking for people to testify, and we'll be trying. I don't know what will happen in the current climate of COVID, whether or not that testimony will be in person or whether or not it'll be virtual. More likely than not, it'll probably be virtual given, you know, all the restrictions with gathering. But we'll be trying again to get it out of the Public Health Committee this year.
Thank you, Shannon. Sharon, did you have a comment or did I imagine? Okay, great. So I wanted to ask, since David Levin is here, he's an incredible legislative advocate for medical aid in dying in New York and part of the advisory board of End of Life Choices New York, and he's here. And I wanted to ask, David, would you mind speaking a bit about the New York medical aid in dying bill? David, would you mind unmuting yourself?
I just tried to, I guess I didn't succeed.
We can hear you loud and clear.
I'm sorry?
We can hear you loud and clear.
Okay, good. So we've had a medical aid in dying bill in New York since 2015. It has gotten out of the Assembly Health Committee once, but that is all, unfortunately. There are increasing numbers of sponsors. There are now 58 sponsors of the bill in both houses of our state legislature, and increasing support. A lot of the sponsors are legislators of color, which is great because both the Speaker and of the Assembly and the Majority Leader in the Senate are legislators of color. The governor supports the bill. There is a new legislative session which starts in January, which goes for 2 years, and we are somewhat hopeful that the bill might be passed in this coming legislative session. One of the concerns that we have is the makeup of the committees, and with new legislators, and there will be 40 of them in our state legislature, there will be a lot of different members, presumably in the health committees in both the Assembly and the Senate. And we have been making some efforts to try to ensure that the new members on those committees will be supportive of medical aid in dying. So I don't know what effort has been made, if any, in Connecticut on your Public Health Committee to, in consideration of who's on the committee, but if there's any way that that can be influenced by the chair of the committee, that would be a great thing to consider, because obviously that makes the difference, because in your legislature in Connecticut, you have a substantial margin of Democrats in both houses. I think it's 90 to 60, something like that in the House, and in the Senate it's something like 22 to 14, I believe. So we have our work cut out for us in New York, but you do as well in Connecticut, and hopefully this next legislative session in both Connecticut and New York will prove to be the one that gets our bills through.
Thank you so much, David. So I wanted to turn to Ulrike, who had a question in the chat a while ago. And I want to honor your question coming through. Ulrike, are you able to unmute yourself and ask your question?
Yes, I'm here somewhere. Thank you for having me on board on this. I find this conversation very, very enlightening. And my question is, although I support all this, I was wondering, how can a person who wishes to have assisted dying be protected from perhaps pressure from family members who might even, I mean, this is not very nice to talk about family members, but I can imagine that this might happen, put pressure on this person to take assisted dying, even though this person may not be quite ready yet. How is that legally worked out? How is that person protected?
So the way the bill is designed, I mean, it's very comprehensive, but you have to have 2 written requests to the doctor, and there's a second doctor that needs to concur. You must be of sound mind. You have to be competent and be willing to self-administer. I don't know if Sharon or Shannon, if you want to add to that, but the bill is very comprehensive to protect the person from being unduly convinced.
Mm-hmm. The person has to ingest the medication themselves. Nobody can give them the medication. So the person has to do that of their own. And the person has to make that request themselves of the care provider. And the care provider has to be able to make the decision that the person's not being unduly influenced. And if that healthcare provider has any concerns about that, they have to have another provider come in and make that decision or send the person for a psychiatric consult. So there's, like Karin said, there are safeguards built into the legislation to prevent that from happening.
Okay, thank you very much.
Isn't it also true that the bill identifies putting that kind of pressure on someone as a felony?
That's also true. Thank you.
Yeah. So the penalty for doing that is pretty strict. It's pretty stiff.
So I just want to jump in here. So Thaddeus Pope is a member of our advisory board here at the Complete Life Initiative, and he wrote an incredible article evaluating MAID in different U.S. jurisdictions, and he talks about the criteria for medical aid in dying, meaning that you have to be of sound mind, and that if there's any question of someone's capacity to make decisions, that it's referred to a third physician or mental health specialist for psych evaluation, and that the patient has to ingest the medication themselves. It can't be coerced by another individual. So I'll send that article out for everyone to read as a follow-up. Thaddeus Pope will be doing a Completed Life lunch hour coming up in February, the first Thursday of February 2021. So please look forward to that. Any other questions? Let's see. Kim Mooney, it looked like you had a question in the chat. Go ahead.
Hi, I didn't have a question. I just made some comments in the chat room, but it wasn't a question so much. It's just, if you're not familiar with Lonnie Shavelson's work, this is a doctor who's been working with medical aid in dying for a long time, and he had a conference last year, 3 days conference on medical aid in dying in every state. It was fabulous. Anyway, they have designed a website that you could get on. It's ACA MAID, and it's the American Academy or American Clinicians Academy. They have such good education pieces on how to talk to somebody. They have a couple of a nurse talking to someone the morning of. I mean, it's a huge resource. So I would suggest that we all take advantage of that. But the questions are just, yay. I mean, I've been doing this, as I wrote, for almost 30 years. So watching the difference between doctors who really understand it and what's happened during the pandemic, it's been a secret gift to a lot of us, because all of a sudden people are like, I need to get this done. So the Conversation Project is one place that has a really nice COVID bump directive.
Thank you so much.
Yeah.
So final question from the audience, from Nicole Natal. How do we get notified of a new bill when it comes up? Is there potentially a listserv to sign up for, anyone to get in contact with?
You can always check the Connecticut legislation website, to be checking for new legislation that comes out if you're interested just specifically for Connecticut. The other things you can always do too is be checking some of the sites, like I'm sure your website probably posts when new legislation comes out. Compassion and Choices is another website that always, gives alerts to when new legislation is being passed in different states. So there's various websites where you can find alerts for legislative actions in your area.
Great, thank you. And Randy posted in the chat that Massachusetts is active with their legislation currently. He posted the website in the chat. And Nancy had a quick comment about the Massachusetts end of life options work. So Nancy, go ahead briefly.
Thank you. I just wanted to say thank you to Karin for producing that film, and I hope that we can help spread the word on our website as well. I'm the president of Western Mass Death with Dignity, and we are working in this state as well to hopefully pass the law this year, but it's not looking so hopeful with COVID and everything else. So I just wanted to say that we do have a petition on our website, so you can just go to Western Mass Death with Dignity. If you know anybody who's a resident of Massachusetts, we're looking to get more signatures, and we'd appreciate your support in helping us collect signatures. So if you have any friends or family in Massachusetts, if you could steer them to Western Mass Death with Dignity, that would be great. We appreciate that. And thank you again for all of your efforts in Connecticut, New York, and to all the individuals who were in the film for sharing your story.
Thank you, Nancy. So I want to offer, concluding remarks for everyone on our panel today. Thank you so much for being here. I just wanted to go around and quickly get your concluding thoughts on, the importance of having the option to have a completed life for you and your loved ones. So I'll start with you and Karin and Bill, and then we'll go around, and then we'll end the session.
So the key for me is that it's an option. It's not mandatory, it's an option. And that someone else should not tell another person how to think or feel. It is an option.
Mm-hmm. And just putting the film together, just the inspiring people we ran into. They'll be with us our entire lives. Sharon and Ralph, Shannon, the pastor, the rabbi,
oh.
Mike and Jen Mazzone, just some dynamic, strong, amazing folks.
Yeah, so we are very honored to have met all of these people.
Thank you. I know Rabbi Michael has to go soon, so Rabbi, would you mind saying a few words? And
I want to say thank you to Karin and Bill and congratulate them on a wonderfully created film. You have tackled a really difficult and painful issue, and I think you have done it with a lot of truth in storytelling, and with a lot of respect for the fact that, as you say, we are all faced, when it comes to questions like this, we're faced with impossible realities and impossible choices, and they are impossible in themselves. The question is whether the society in which we live has enough, the Yiddish word, rachmones, right? Whether it has enough mercy to allow us to navigate these difficult, these impossible choices, and bring our understanding, our take, our religious traditions, our families, all of that complexity to that kind of a discussion and decision without necessarily criminalizing it and making it a taboo over conversation. And I think for raising that level, that conversation to that level, I'm truly grateful to you for the film, and I hope that it continues to be inspiring for people to actually have a conversation, whatever the decision is at the end, we're actually having a conversation. And I want to thank whoever brought up, I'm sorry, too many people on the screen, whoever brought up the point of you're never too young to actually have a conversation about the directives and making sure that they're known. Today, technology enables that, and I want to encourage everyone to consider it and have a conversation with yourself and with your family of what you want to do.
Thank you, Rabbi. Sharon, would you like to share a few thoughts?
The day Karin called out of the blue to ask me if I would be interested in sharing my story really was a blessing in many ways, a gift to me and my family to be able to do that and bring attention to such an important matter for anyone, ill or not. So thank you for that.
Thank you, Sharon. Shannon, go ahead, please.
Again, Karin and Bill, great job on the documentary. It's a wonderful piece, and I really appreciated being a part of it. One thing, I know I didn't talk too much today about my dad's story that's told in the documentary, but one thing I do want to say is that my dad was an educator, and through his own process, he taught me so much about death and dying, and I was so grateful to be able to tell his story in your documentary. And I felt like being able to learn to teach about end-of-life issues and palliative care, it was a blessing. And to be able to tell his story in your documentary, that was a blessing too. If there's one parting word of advice I can leave anybody on this call, it's about the advance directives. So if anybody, learns from today, it's make sure you make a copy of your advance directives and get them known to your loved ones. And lastly, it's about the nursing and that nurse's role. The ANA now has engaged neutrality toward end-of-life decision-making, toward the medical aid in dying. So now nurses, while we can't, and we're not allowed to participate and hand the medications to the patients to ingest, we are most certainly allowed to counsel patients about their options. So any nurses listening, we now need to be aware of medical aid in dying options, and we now need to be talking to our patients about those options. So we can't give the medications, but we can certainly be aware and be available to counsel patients on their options and be there for them and listen and be available to talk to patients and be present with them at the end of their lives. So that's all I have to say about that. So thank you.
Thank you so much, Shannon. Reverend Joshua, please go ahead.
Sure, yeah. Well, first, again, congratulations on the film. It's a wonderful film, and I don't get to be in films very often, so it's nice to have been included. I think the way the law stands in Connecticut right now is very black and white. And the truth is, life is not black and white. Life is filled with gray. And while probably the majority of people would never pursue medical aid in dying, there are always some who will. And that's where life gets very gray. But the way the law is written in black and white, it just cuts off any chance for people to consider how they want to have integrity at the end of life, any chance for compassion, any chance for meaning making, for people who want to explore it. So that's why, as a pastor, I feel it's important to actually get involved in the political advocacy for medical aid in dying in Connecticut. It's a way that I can serve my people in pursuing their spiritual lives at the end of life. Again, thank you.
Thank you so much, Reverend Joshua. And Ayana, please, any thoughts before we conclude today?
Sure. Today's discussion was great. Thank you for all the participants. I really learned a lot. And I think it's really important for us to have these conversations amongst the different Northeast states. It's nice to hear about what's happening with Massachusetts and Connecticut and from New York, where we're glad to have the opportunity to share what we're working on. And I hope we can continue these conversations. I saw there was someone from Georgia. So I think it's really important to kind of have these conversations nationally. And I'm excited that we were able to co-host this event today. And we had over 80 people on this Zoom, so that's fantastic. So thank you, Sarah. Thanks, Completed Life. And once again, thank you, Karin and Bill, for your great work.
Thank you so much, Ayana. And thank you all today for being present here and having an incredibly illuminating conversation and discussion. It's been an honor to co-host this inaugural film discussion panel with you, Ayana, and End of Life Choices New York. Thank you so much for co-sponsoring, and thank you so much to Karin and Bill for creating this incredibly important and powerful documentary. It's changing the world one step at a time and one viewing at a time. So thank you. And thank you to our incredible panelists, Sharon, Shannon, Reverend Joshua, and Rabbi Michael, who had to step away to officiate a funeral. So thank you so much for your insights and your presence here today. It's been incredible, and it's just been an honor to moderate today's discussion. So thank you to our audience for your questions. Please visit our website, www.completedlife.org. There are many resources on advanced directives. There's also archival recordings of the Completed Life Fall 2020 conference, which touched on many of the issues that were brought up here today. And as well as please visit End of Life Choices New York website as well. Links to the websites are in the chat, and we'll be sending out a follow-up email to all of you with additional resources for questions that were asked today. So the recording of today's event will be published as well and available, and you'll receive a copy of that as well. And the next event in Completed Life Initiative programming is the first Thursday of January 2021, where Peggy Batten will lead a Completed Life lunch hour on experiencing the least worst death regarding her TED-Med talk. So please stay tuned for that. We look forward to seeing you there. Have a wonderful holiday season, and goodbye for now. Be well.